find most of the time as practitioners, we are telling people, do not suffer in silence. Help is always there. But where is this help? Actually, e-therapy is a very good development.
Yes.
Because one, it expands the reach for mental health care. For me, I normally feel still we are not coordinated.
Yes.
When it comes to mental health services, because for any service, health service, we need a coordinated referral pathway. How can we be able to train the community health promoters to deliver these services at the doorsteps of the households?
Hello, my name is James, and this is Convo, encouraging conversations that matter. For so long we've been discussing about mental health because mental health is an important conversation in our community. Today, I'm so delighted to host one of the person who is advancing the mental health conversation, and that's Emily, the founder of Psycho Africa Solutions. I want to engage her to understand more about the mental health care systems in our country, how it's struggling, and what we can do to improve our health care come to mental health. And, we've been doing a lot in mental health, and this conversation continues. Are we doing enough as a country when it comes to mental health? What is happening? These are some of the things that I'll be engaging Emily to understand. But before I continue, I'd love Emily just to say hi, introduce herself, and tell us more about herself. And then from there, we roll on. Thank you. It's good to have you, Emily. So delighted to be in your office today. And it's always an honor to be welcomed. And so we are so glad. So maybe we could start with you telling our viewer who are listening, maybe more about Emily. You can say hi to our viewer, and then from there we kick on.
Thank you, James.
Yes.
Hello, everyone. My name is Emily Gideon, and I'm a clinical psychologist. I'm also a gender expert. I am the CEO of Psycho Africa Solutions. And also I'm a consultant with government projects financed by World Bank, and especially on issues to do with gender-based violence.
Yes.
When we come to projects, we talk about sexual exploitation, sexual abuse, and the sexual harassment.
Yes.
So that is majorly what I do.
Great. Thank you. Now you know whom we are talking about, the best, the experts. So anything you get from here, you can be sure it's coming from an experienced person, someone who has been in this industry for quite some time. Emily, maybe just to start off, what led you to clinical psychology?
Wow. It has been a long journey because I started very far.
Okay.
Started very far, doing a few short courses on counseling.
Yes.
Then from there, moved to HIV testing and the counseling. Then to diploma in community development and social work.
Yes.
And then from there is when I felt whatever I'm getting in whatever I'm doing was not enough for me. And that is what led me to psychology and the why. One, to me, it's like reaching out to people and helping was like always a passion and desire in me, like a calling. But to add on that is also growing up. I also witnessed some vulnerabilities, some traumas during childhood. Quite unmet emotional needs. And both of that, my passion, my desire, always reaching out to people, to support them, to listen to them, is when I realized that people go through a lot of pain. And they also deserve that dignity, that safety, that support, and also some hearing that is not judged. And that really pushed me to psychology. But when I did my bachelor's psychology, I was in between. What do I specialize in? Do I go ahead with counseling psychology? Do I go ahead with clinical psychology? I also had some interest in forensic psychology. And still, I also up to today. I have strong interest in child psychology, but I couldn't get in Kenya where I could do that at master's level for child as a child psychologist. So I went for clinical psychology because I felt that I needed to get that, to be equipped with tools whereby I can hold people's stories with responsibility, combining that with empathy and also with evidence. And that also I can also be able to go deeper and bring out or understand the underlying situation. If someone is, let's say, for example, someone is having issues with alcoholism. It is not about counseling or addressing or like why like telling them you need to minimize or you need to reduce and giving them the tools to help them on how to come out of alcoholism or addiction. But I felt I need to understand it deeper. What is the root cause which is leading to this? What are the underlying issues that is leading to this? And for me, that pushed me to clinical psychology. I don't regret. I just feel home with clinical psychology.
Wow. I love that. And I love the fact that sometimes we go through experiences that shapes what you become later in life. And maybe, I don't know whether it's the same inspiration that led you to found Psycho Africa. Is the same inspiration, or what did inspire you to found Psycho Africa?
When I was practicing, I've worked in hospitals, I've worked with NGOs, I've worked with different entities in rooms doing therapy and all that. And I kept on feeling that even when individuals are coming to therapy, therapy alone is not enough. And why? It is because sometimes we do the sessions, the healing doesn't come through, or it is quite, there's forth and back. Is when I realize that people, even as they are going through therapy, they have systems which are around them. Their families, workplaces, we have the community, we have the schools. And sometimes we find why they are coming to therapy, it is from these systems. So we are handling them to therapy, equipping them, with tools and the strategies, but they are still going back
to the same system,
which is harming them, which is making them sick, and all that. So I felt I needed to get deeper. Away, just doing therapy, but now beyond therapy. And trust me, I started Psycho Africa knowing, for one, it would be a private practice. But on the other end, how do I get deeper to these systems? I went in not even knowing how to go about that, but I always believed that I have to get a situation to that.
Wow. That's quite an inspiration. Maybe going ahead, Emery, I know out of experience, and you've worked with a lot of people in different areas and different communities. And when you talk about mental health, what are the common mental health challenges, based on your work, and what are the common mental health challenges that you could say that are more prevalent?
Across different ages, are also different genders, that is male, female, whether children, adolescents, adults. One thing we are realizing is that there is that high raising in anxiety, depression, trauma, and also substance use.
A big problem.
Bipolar, still there, which sometimes people don't. There's a lot of misconceptions around it. And one thing we're also realizing is that people with lived experiences of chronic nature of stress. And then also people living with prolonged uncertainty. We're also having the economic pressures and emotional overload, which escalate their mental health situations or the symptoms that they are experiencing. So taking me back to where I started, that mental health is not just therapy alone. It is not just symptoms alone. This is where this is coming from. And then again, also looking at with all that raising of the things, the situation that I've mentioned, then also, again, the perceptions and the understanding of the society towards mental health, we still have a gap. We still have a lot.
Talking about misunderstanding.
Yes.
Do you think there's what are the most misunderstood things when it comes to mental health?
Wow, quite a lot. Allow me just to mention briefly.
Yes.
Overall, what is the perception of mental health as a whole in our society or in our community? We talk about mental health day and night, but how many of them are taking it seriously? One, it is becoming just a normal talk, and people just throw it in here and there. One, people look at mental health as a curse, as weakness.
Yes.
As witchcraft.
Yes.
As evil spirits, especially for psychosis.
Yes.
But now, let's look at depression. Sometimes in the society, because some of the prevalent symptoms for depression is feeling that you don't want to do anything. You do not have energy to come out of the bed. You are losing interest in whatever you used to do, whatever you used to like. And in the community, it can be interpreted as laziness.
It's true.
People become withdrawn because of depression.
Yes.
But people look at them as they have become proud. They're having attitude. They don't want to talk to us. And that person is pushed away. Not knowing this person is crying
from inside
and for help.
Yes.
Depression could come with suicidal tendencies, suicidal thoughts, and even suicidal talks.
Yes.
And then you are seeking attention. You are the drama queen and all that. And even people say, if you wanted to die, you could have done it. If you were serious, you wouldn't be here talking about it.
Yes.
Then also let's look at something like substance use disorder.
Yes.
The most misunderstood. In any family where we have an addict, they always blame that person.
Yeah.
And always they are told, if you wanted to stop it, you must stop it. It is not easy. And people will give you examples. People will say, me, I used to drink a lot. But I woke up one day and I just decided enough is enough. Why can't you stop? This is what people don't understand. If you woke up one day and decided to stop and you stopped, your underlying factors are quite different with my underlying factors. But one thing that the society and the families need to understand, addiction is a brain disease. It is a illness. Today I will go get prayed for in a church. Even the bishop gives me a new Bible. But the next time, hiyo Biblia utaiokota kwa mama pima. Because when it is a disease, when the brain demands for that substance I use, let's say alcohol, it doesn't matter what I promised my bishop, it doesn't matter what I promised my family, because it is beyond what I want. It is beyond my wishes. It is beyond my family desires. It is a disease. And alcoholism, addiction needs to be treated as a disease. Then also, again, briefly, when I go to psychosis, let's say schizophrenia, when people start seeing things other people are not seeing, hearing voices, nobody is hearing them. And then people think this person has been bewitched. This person has evil spirits that we need to do exorcism.
Yes.
This person, what they need professional help. So for me, I feel we have that gap still in Kenya on psycho-educating and educating our society on mental health. Because when that understanding misconception comes in, then now the opportunity for this person to access treatment, to access care is taken away because nobody is understanding what this is all about. And sometimes some symptoms of mental health can go beyond what we can comprehend. And I'm not saying that people not to seek for prayers. But as you seek for prayers, kindly also seek for professional help. Work with the two.
Okay.
Exactly.
Still before we go from that bit, is this something that you feel it's under discussed when it comes to mental health?
That is true.
Yes.
One, mental health itself and how it presents and the underlying issues. Yes, we can talk about the symptoms.
Yes.
But now the underlying situation, that is overlooked. That is not discussed.
Yes.
Then also when it comes to, you find most of the time as practitioners, we are telling people, do not suffer in silence. Help is always there. But where is this help? Where is this help? Yes, help is always there.
Yes.
But where are we directing them?
Yes.
Where are we directing them?
And Emily, discussing about barriers and all these, maybe, I don't know, the reason why I ask this question, I think because of your experience and how many years you've been working with the community, is what are these barriers that are preventing people from seeking help?
There are quite a number of barriers. To start with, look at, when we talk about mental health services, mental health care, people being able to access comes with a lot of barriers. And one of them is availability. Are these services available? And you find most of the time, these mental health services and the practitioners are only present in urban centers. That is where you find us. But now when you go deep into the villages, are we available there? Are these services available there? Then the other thing is affordability. Are these services affordable? Mental health services are very expensive in Kenya. Are they really affordable? You get that? Apart from affordability, we're also looking at geographical coverage. You may find that I live very far from the urban center. That distance, can I even afford even the cost of going to reach where the services the services are? So distance also becomes an issue when it comes to the accessibility of the services. And then also again, I'll also talk about the quality of the care.
Very important.
Quality of the care. We have seen on social media pages someone who has been mismanaged, someone who has been mishandled. So it means it becomes a barrier, because even if tomorrow that person wanted to go for therapy, the trust has been washed away, and it's like these therapists, they don't help, they mismanage people. So now that poor quality becomes access barrier, because that trust has been washed away. Stigma becomes also a barrier, because someone doesn't want to be seen that they are going for these services, and it comes because also of the societal perceptions, attitudes towards mental health care. It creates a lot of a big barrier, and the stigma is a big issue. Then also the cultural perceptions, the cultural interpretations, and especially when you talk about this, I also look into men. How many men? I know men are doing well. We have started seeing changes, and quite a number of men are going for therapy. But also, there are men out there. You tell them about going for therapy, and they're like, "Are you okay? To do what? I'm a man." The masculinity, the upbringing, the cultural grounding that mwanaume anakufa na shida zake, mwanaume ongeangi mambo yake, jikaze kama kimwanaume, then it takes away seeking help. So there's a lot of cultural grounding that we need to take up mental health. And now what Psycho Africa is, like I was telling you, when I realized the systemic issues. And that is one reason why I founded Psycho Africa, is to reach people beyond therapy. Because now these systems, both structural and the cultural systems, we need to reach out there. And for the therapists and the fellow practitioners, the future of mental health is community. Doing the community mental health and the psychosocial support.
Awareness. Psychosocial education. Yes. You mentioned something very important there, and I would love you to maybe shed some light there, because I've heard from so many people not wanting to seek therapy because the time they sought therapy, their experiences the therapist was not good, they didn't feel as though they got help. And so anytime you tell them about therapy, it's something they don't relate with. What is your experience and what would you say about that issue?
Allow me to say that when I was young in psychology, I also went for therapy. And the issue that which I took to therapy, my therapist referred me to the church they belong into, because there I could get help through prayers, and every time the therapist wanted me within the therapy room, we say prayers and all that, and I was very disappointed in that. But one thing I knew, that is not the only therapist, so I went ahead to look for another therapist, but now I had to consult. And I remember, I was a young professional in psychology, and I had to consult. And I look for the therapist that I was looking for. And nowadays we are lucky, because when you go to even online, we have platforms, starting with Convo and the other platforms that now it's like a page where you can go click and look for different therapists, and they are there. And to me, I'd say to anyone who has been mishandled, disappointed by their therapists, that is not the end. There are an array of therapists in this country. Don't stop going for therapy. Do not fail to seek for help. Because someone mishandled you, or you felt that you were not compatible with that therapist. Out there is still a therapist who you are compatible. You are compatible with.
Wow. That's good for people to know that because you had one case scenario with one therapist, does not mean that
all therapists.
Yes. So I think you just mentioned something about the new technology and different ways, and you mentioned about the e-therapy. I'd love to hear your opinion about e-therapy.
Actually, e-therapy is a very good development. Because one, it expands the reach for mental health care. And people are able to access therapy from wherever they are, from the comfort of their house, from the comfort of their office, without having to travel to go and see a therapist. If well done and not abused, it reduces stigma. The people who feel I can't be seen going to a therapy room. But while on my phone, I can just click and have a conversation with a therapist. There are also people who have very busy schedules, and they do not have that time to walk to physically or in person to a therapy room. Online therapy or the e-therapy will help
a lot. Wow. I like that information.
Yes, it will help a lot. But also it also has some limitations.
That's what I wanted to also to come to and ask you. Where does it work well? And what are the limitations? And where do we need to be cautious when we think about e-therapy? Is there some things that we need to consider?
For me, I'll say that for e-therapy, the mild, the moderate psychological issues that people are experiencing, or ongoing therapy, follow-ups, therapy issues to do with like psychoeducation, skills-based interventions, and even doing a follow-ups with the sessions that had already been started, that can work well with e-therapy. But also sometimes there are also situations that e-therapy won't be ideal, and that is where we need also to be cautious. Because sometimes we have complex mental health situations. Someone, and also crisis. If someone is suicidal, it wouldn't be advisable to have e-therapy with that person. That is someone who needs in-person psychological evaluation, some of them psychiatric evaluation. We may also have someone with psychosis symptoms, someone who even cannot comprehend even what you are telling them, that is not someone for e-therapy.
Yes.
But also, again, also I say that it is for the therapist, discretion of therapists to know where is the boundary. Where is the boundary? Which are some of the clients that comfortably you can handle them through e-therapy? What are some of the situations and the symptoms when they are in play? Now, immediately, you refer or you request that client for in-person kind of therapy. We are not saying that e-therapy is not working. It has helped a great deal. But now when it comes to the complexities, situations, then it may not work and remain.
More this is required.
Exactly.
I like that.
Yes.
Great. Now, let's move on to something else. I like this conversation so much. Let's talk about therapists and other practitioners. Establishing a private practice is not easy.
It isn't.
One, there's compliance, there's all these manner of things. But at the back of someone like you, you're thinking about sustainability. Is there an advice, or what would you tell people who are starting out, who want to set up a private practice in terms of sustainability and all that? And the system that they need to put up in place. What's your thoughts?
James, what I can tell you.
Yes.
Private practice is not easy as it is said.
Yes.
And one thing I realized when I came to this space is that in school, as a psychologist, I was trained on how to handle clients, on how to offer mental health care. But I wasn't trained on system operations, business operations. And then now when you come to the room and you are trying to do solar, you are trying to look at to apply the ethical standards, because there are the ethical standards of when you are in business, in therapy, this is what you should not do. But now there is the issue of the whole business operation and the systems operations, because you'll have people working under you, you'll have other, like you're saying, compliances, which were never taught, in a class. There's the issue of pricing. So how much do I price? And all that. It is not an easy one. And that is where I normally say, consult. For the therapist, consult. I know I've gone through a very rough time starting off Psycho Africa and where we are, and I'm not even off the woods on stabilizing and doing all that. But one thing, perseverance and resilience, and looking back to why did I start? Why did I start? Then also again, we normally say learning is not a one-day thing.
True.
Keep on educating yourself, but also again, keep on consulting. I've really been consulting, even with my colleagues who they established their farms many years ago. And when I talked to them, and they told me that what you are facing right now, mine was even worse. They tell me the financial crisis they went through. That, opening a private practice is not like opening a shop where you're selling beans and maize, everybody's coming. Can I have a packet of flour and all that? Or even a hardware where someone will come for 2 packets of cement. It is not that way. It may take time to pick. Then also, I'm also realizing a lot of marketing and the visibility. And I came to learn this by doing consultations with the people who have been ahead of me, doing consultations with people like Convo Africa, and just understanding what does it take? What does it take? And trust me, things I can see some positivity, things have started changing, but it is not easy. And the saying it is not easy, I'm not discouraging anyone who is planning to start their private practice. Consult and also collaborate. Collaborate with others. Do not work alone. Collaborate with others. But also you need a lot of perseverance. And above all, your guard should always be your ethical standards.
Ethical standards,
Ethical conduct. That is very key, because when you lose that, your clients will start losing trust in you because of an unethical behavior, and unethical conduct. And once the clients lose trust in you, so whom are you going to be handling? Whom are you going to be attending to?
Yes. Wow. I like what you said, and the fact that consort further and collaborate.
Yes.
Now, when you think about Emily, about mental health, and I think you can look at this nationally. It's our country, what you're doing in terms of mental health, the kind of systems that are there, and the kind of organizations that are there. Do you think if we had better systems in our country and a better organization in terms of mental health care, would have achieved more? Is there something you would say about systems that support mental health care, or how is that look like?
For me, I normally feel still we are not coordinated.
Yes.
When it comes to mental health services, because for any service, health service, we need a coordinated referral pathway.
Yes.
When you look at like, let's say something like gender-based violence, which is also my area of practice, you find they are coordinated and they laid down SOPs on referral pathway. Referral pathway is knowing, for example, in gender-based violence, is knowing if I have a sexual violence case, I know this person needs to get to the hospital, to any healthcare within 72 hours for HIV prevention, pregnancy prevention, being treated if they have any kind of wounds. I know from there this person needs to be referred to the legal where and to do what. If someone who is at risk, we know this person needs to go to a rescue center and all that. So there is a coordinated system.
Yes.
But now for mental health, the coordinated, we are fragmented and we work in silos.
Yes.
It's me and my private practice trying to see how many clients I can pull to myself.
Yes.
And trust me, alone, you can't do it. Because we still operate in the systems and our clients are coming from different systems. So that coordination, I feel we miss that coordination. And maybe also in future getting let's say a kind of coordinated working groups whereby we can do like case presentations. We can be able to have these forums and then look at what is more prevalent. What are the challenges that we are facing as mental health practitioners and all that. I feel we still have that gap.
Wow. I mean, now let's cast our eyes into the future and look at 5 years.
Yes.
So how do you look? How do you see the mental health care looking like? What would you want to see?
Yes.
In 5 years down the line.
For me, one is what I've talked about, that coordination.
Yes.
A smooth, coordinated mental health workforce.
Yes.
And, united, when people coordinate, we start avoiding duplication. We also start knowing what are the systemic issues and the gaps, whether structural, whether cultural, and all that. And also, again, when we have that coordinated mental health workforce, I'm happy now we have the board. There, Kitambo, we never used to have that.
Yes.
I also like what the board started doing, licensing individuals, licensing the firms, that is the private practices.
Yes.
That is good. But they also need to go an extra mile and start cracking the quacks out there. Because these quacks, the moment they mess up someone, even in the social media,
yes.
It is mental health practitioners. But these are some of the quacks. You have someone who went somewhere for a counseling short course of 2 weeks, and they're there masquerading as therapists, as psychologists, even doing mental health assessment like clinical psychologists and all that. So cracking and cleaning this industry because it has been misused for a very long for a very long time. But also again, I'm also looking at a future whereby now we are looking into these systems and being able to take mental health to the people. They say if the mountain cannot come to you.
Yes, then you go
to where the mountain is.
Sure.
And for one thing that I'm trying, and we had discussed this earlier, is looking at what are the barriers of access?
Yes.
Is it affordability? Is it about an availability of these services? So looking at, when you look at the Ministry of Health, Ministry of Health as a community strategy, where we have the community health promoters. How can we be able to train the community health promoters to deliver these services at the doorsteps of the households? Yes, because they have the allocated households. So because it is what WHO calls task shifting. You are training the non-professionals to offer the basic services. We are training them on the basic mental health assessment, so that now they're having a clear way of linking the people whom they feel needs psychiatric evaluation, psychological evaluation, and they link them to where they can get services. So we are integrating mental health into the primary care services in full. If we are able to do that and look into community mental health support, then we'll have gotten it, because it means more information to the community. So clearing stigma, because stigma comes a lot because of people lack that what you call mental health literacy. They do not understand mental health well. If the society understands mental health well, then we promote and increase the uptake of mental health services. Then also again seeing how do we bring mental health services out of these walls. You come into South Africa, these are walls, a clinical wall. How do we bring it out here? Take it from here and take it out there. Take it out there, culturally grounded mental health care. Because still mental health sometimes it is like foreign. It's a white man thing. So how do we integrate it into our cultural language, our cultural systems? How do we integrate it to that so that it can feel home? When we go to the community, we have the transitional healers. We have the birth attendants. These are the people who need to be trained about mental health, so that when they are reaching out to their fellow villagers, it is from us. It is the language that we understand in the environments where we are quite comfortable. For me, that is the future I would wish to see, where we offer mental health services as Africans, as Kenyans, in the languages that they understand.
Wow. And the community level.
And the context that they understand. In those areas, the environments that they trust most and they feel comfortable.
Wow. Wow. That's huge. That's huge, Emily. And I like what you said. In Kenya, I think we have the CHPs, community health promoters. A very brilliant idea. But we need to empower those people even to understand, because they're interacting with all the communities. And actually, if all of them can be able, in 5 years, every single family will be knowing more about mental health. But what do we need to do urgently?
Actually, it is an initiative. A program that I've already developed. It is ready for rolling out. So I'm looking for collaborators. I'm looking also for financiers. And we roll it out. We roll it out through Ministry of Health. Because we need to take mental health out here and take it out of these walls of clinical setup, so that it can fit. We normalize it. We normalize the mental health care. This, when people feel something is not culturally appropriate. It's the high time we make mental health care culturally appropriate by using their language, and also tapping on what we call cultural wisdom. Briefly, allow me to say this, that in each community, there is how they are able to support each other under their own terms, under their own traditional practices. So how can we be able to tap on those practices, on those traditional beliefs, on those community traditional or cultural structures, and integrate mental health in that? Yes.
Wow. And that's something that needs to be done urgently.
That is true.
Now, winding up, because of time. What is that one thing, or maybe two, you wish the public understood about mental health?
Wow. Now, this is huge. I'll start with our religion, with our religion, whether Christianity, whether Muslim, whether Hinduism, whatever religion you believe in.
Yes.
Allow me to say that mental health is an illness. It isn't a curse. It isn't a sign that your faith is growing weak. It is not a sign that there's something you did and God is punishing you.
Yes.
It is an illness. So if it is an illness, the way when you have malaria, you have pneumonia, you have a broken leg, you quickly go to the hospital. The same as mental health.
Yes.
We need to start seeking for help. Because sometimes we sit with a situation until it gets worse, it gets more complicated. Let's embrace mental health services.
Yes.
It's not a weakness. It is not a white man's thing, because when you are experiencing those symptoms, you are not a white person. Kindly let us learn to seek for services.
Yes.
And when we go to social media, when you go online, the psychologists, the therapists are all listed there. When you walk into any government health facility, you are going to be helped. But because I'm sitting and speaking under the seat of Psycho Africa Solutions, I'm going to say in Psycho Africa, we understand you and we offer culturally grounded mental health services. So you are highly welcomed to talk to us. But I'll repeat what I said we normally say. Do not suffer alone. Help is always available in Psycho Africa Solutions. And in anywhere else, you can get a therapist. Kindly let us also support our loved ones who are going through issues, who are struggling emotionally, psychologically, so that they can be able to seek for help.
Wow. That's amazing. Thank you so much, Emily, for sharing. I know time failed us. We could have discussed quite a number of things, and I believe that I'm going to come back because I think we should talk about mental health first aid. We need to talk about, psychoeducation. We need to find ways. How do we take this information and literacy into our community, like you're saying? To everybody in our community. So I think that begs that we're going to talk about it more, but I'll visit you again, and I think you'll help me.
You're most welcome.
And,
Anytime.
Understand this conversation, helping our community find help. I think mental health is a big thing, conversation. It has been overlooked for so many years, probably because people do not understand what it actually is. And I think when we start these conversations, we slowly start opening that space, and people appreciate mental health. So again, I am so thankful. We're going to come more with this conversation. If you have questions, you can always ask. If you want to visit Psycho Africa, if you want to see Emily, we'll put up her contacts down here so that you can always call her, visit her office, and maybe find help or even find help for your loved one. So again, my name is James. I'm so grateful for you joining us.